Hi friends, welcome back to Coffee with Ravi. Today our guest today is Dr. Sial. Dr. Sial is one of my colleagues, gastroenterologist, and has been in practice with us since July of last year. Dr. Sial is here today to talk about colon cancer screening. March is Colon Cancer Awareness Month, and he did an excellent presentation to our staff about colon cancer screening, and that there is a new change where they've recommended dropping the age of starting screening to 45. So in other words, his presentation, which came from a comment that one of you had made to him, which is that 45 is the new 50. So welcome, Dr. Sial. Why is 45 the new 50? What can you tell us about colon cancer screening? What are the rates in Iowa, and how we can take it down?
Thank you so much, Dr. Ravi, for having me for this coffee talk. Yes, it was an interesting title because one of our patients who came in and we're sort of discussing about the age 45 being the recommendation for the newer screening guidelines, and said that 45 is the new 50, and that became our title for this March Colon Cancer Awareness Month. So we can go a little bit into the background of colon cancer. This is the fourth most common cancer in terms of incidence in the United States, and also in terms of mortality. So it does have a huge impact on the economy and on the health of people. When we look at Iowa, the state of Iowa, and compare it to the national average, you can see here on the slide that it is a little bit on the darker side, which means the incidence is on the higher end compared to average. Next, if we look at our Black Hawk County, that is somewhere in the middle, but we do have some surrounding areas with higher incidence of colon cancer compared to the national average. So this is a very important topic from that standpoint. Overall, if we look at, it's important to understand how screening works and what the pathophysiology is and the mechanism of cancer development. And we have a slide here. As you can see, it is fairly simple. But if we look at the next slide here, this is a very simple way of explaining this. You have normal lining of the intestine, and with a mutation that can lead to development of small raised lesions, which are called polyps. And with further mutations, the polyps can grow in size. And it does take some time for these mutations to develop and the polyps to grow. So that is where we can intervene, identify, and remove those polyps and prevent colon cancer.
And that was what we were trying to explain on the previous slide, where there was all the genetic changes. So it takes several years for the genetic changes to become a polyp, and from then the polyp to become a cancer. So we're trying to head it off. Exactly. Essentially, what we're trying to do is by some form of method. In our case, colonoscopy is what we recommend, but there are other methods to prevent it, but we're trying to head that change off, right?
That is 100% correct, yes. This next slide actually tells us a little bit about the first recommendation that came from the American Cancer Society about recommending 45 as the starting age for colon cancer screening in average population. This was an interesting study that they did because the data was based on computer modeling studies, and what they overall realized is that starting screening at 45 did make a significant difference down the line.
Yeah. And the current standard so far has been 50, but that's the recommendation now from, as you'll get into, is to change that down to 45.
That is correct, yes.
And this is for people who have no family history, no prior polyps. This is just average, what you're calling average risk.
That is correct, yes. Most recently, this study was published in the American College of Gastroenterology, recommendation by Dr. Shaukat, and they are also recommending starting screening at the age of 45. And what they realized is that starting, again, going at the mechanism of the colon cancer formation, if you can identify and intervene sooner, that prevents risk down the line. First of all, you can remove the polyps at a smaller size and obviously prevent cancer and things like that. So, our last slide here is what we basically see an impact of colon cancer on general population, and recently we lost a celebrity who starred in Black Panther, Chadwick Boseman, and he passed away at the age of 43. So this is definitely very important and is coming in the recommendations.
Any ideas as to why colon cancer incidence is increasing in people who are younger? What do studies show?
Yeah, that's a very good question. Overall, we can't pinpoint one single reason, but what we realizing is that the Western diet with more red meat, more carbohydrates, probably has a significant impact. And as we're seeing the population is slowly aging and reaching their 40s and 50s, we're starting to see colon cancer becoming more prevalent.
Okay. So things that we can all do, folks, is I think thinking about this from a screening standpoint, and that's whether it be the age of 50 or soon to be 45. The United States Preventive Service Task Force is coming up with this recommendation. It was in draft form, and once that is completely in effect, perhaps this summer, most insurances would start covering that. The second aspect that we can all do, as we talked about, is to eat a diet that's more plant-based. That seems to be having some decreased risk of colon and gut cancers, and as much of activity and exercise and staying at a lean weight, all of these help. So those are things that we could take away from this discussion. Thank you, Dr. Sial.
Thank you so much, Dr. Ravi.
And if you have any questions, always please reach out.